habit I need to get into. Okay. But that reminder, John, is a good habit for you, for me. That's great. Thank you. So I'd like to welcome the partners, our CCRR directors, 211, Department of Human Services, the Research Institute at Western Oregon University, Portland State University, Oregon Center for Career Development, and Inclusive Partners. Also, I know we have several Early Learning Division members on as well, so welcome to them. And I'd like to start this particular meeting with I know we announced it last time, but we actually get to introduce Leslie Barnes, who is our Spark coordinator, and we are so happy to have you on board, Leslie. And we did prepare her for this yesterday on her first day, and said she was going to be joining this meeting every week. And she agreed to share a little bit about herself and anything else you might want to talk about, Leslie?
Right. Well, good morning, everyone. Thanks for having me jump right in today. As Margie said, I am the new Spark specialist for the state of Oregon, and I've been working in the early childhood field for over about 20 years. I most recently left the CCRR Multnomah County as a quality rating and improvement specialist. And I was working with the implementation team for the state of Oregon. So I'm really excited to look at QRS as a system and ways that we're going to uplift providers and supporting them through their quality journey, and also look at culture and look at equity and really see how we can bring folks along. I know that's not just about a portfolio, but it's really about how do you interact in all the ways in your program, your environment, your interaction with parents, your ability to run a successful business during COVID, those kinds of things. So these are the ways that we're thinking about Spark, and hoping that, the pandemic doesn't make people think that, Spark is over, but it's really about how do we adjust in this new world that we're in, and that everything we do is about quality. And so I'm really excited to really jump right into that and really support the work. I most recently have been working though with the Oregon Provider Relief Guide, and got to really hear firsthand about provider struggles around COVID and how do we support their businesses. And we know that this just really brought up and highlighted all the things we already knew about our field, that, our folks are not strong in the business acumen, their needs supports, and like, how do we really support them and bring them along, folks that don't speak English and folks that don't have access to the internet. What does quality look like for them? And so this is what we're going to have to look closely at and really bring the system up to where we are. So I'm happy and excited to see most of you all. I know most of you, and yeah, we'll be working together a lot. Thanks.
Thank you, Leslie. We are thrilled to have you, and we're learning a lot just in how to onboard remotely, right? So we'll be spending a lot of time on camera as we're filling you in and just getting everyone caught up with all the work that we're doing. So thank you, Leslie. Okay, so with that, let's go ahead and move into our updates. So Joan, we have you on to talk about the child care guidance draft discussion.
Okay, well, good morning, everybody. Just want to thank the whole CCRR agency group for nominating such great representatives. We had a great conversation last Friday afternoon talking through the guidance, what things were clear, what areas could be made more clear, what kind of resources we're going to need to help people support. And I really appreciate the feedback. We got a lot of feedback on the online survey that was posted on our website. I think David said we got 1,200 responses in the few days that it was posted. We are analyzing that, kind of digesting it. David's putting together a little bit of a summary document that we'll be using as we consider that input relative to the guidance document itself, and we'll be beginning that process this afternoon. We are still on track to meet our release date of August 14th. We have scheduled a couple of calls with childcare providers next week. I know that some of you, maybe all of you, I just happen to be copied on some of your communications. I know some of you have been communicating about that directly to your providers in your region as well, which is very helpful. The call next Wednesday, August 5th, is really for all childcare provider types, and it will be a traditional webinar format where we'll be presenting information regarding the final draft of the guidance. We will not be taking input at that point. We will be done with the input process. And then on Thursday is the Spanish speaking provider call, Thursday evening. And I think that's pretty much where we are with the guidance itself. After, so next week, everything will be, by the end of next week, everything will be going for translation. Our goal in releasing the guidance is to release it as soon as we have all of the translations complete and no later than August 14th. So I don't know if there's any questions about guidance process, where things stand. I'm happy to take those if there are.
Do we have any questions, comments? Mary.
Thank you, Joan, for sending it out in all languages all at the same time. I appreciate that very much.
Thank you.
Thanks, Nancy. Mary.
This may not be the time to mention this, but since I wasn't in that group, I think the mask requirement for teachers is going to be extremely difficult. And you're going to get a lot of teachers that are not going to be able to do it. And that you really might want to think about emphasizing, as you have, the sanitation and the stable group, and to wear a mask anytime anyone outside of that stable group comes in. I just think that's going to be very, very hard for teachers.
So I just want to provide clarification so that we're all talking from the same playbook, which is going to be really, really important as this guidance actually becomes reality. So face coverings are actually what we're talking about for adults who are in the childcare setting on a typical daily basis. That includes cloth face coverings. It also includes plastic face shields. A mask is actually a term that according to how OHA has defined it, refers to something that is medical grade, and we are not requiring the wearing of medical grade masks, except for the individuals that have to be with a symptomatic child or adult until they're able to leave the facility. I do that, Mary, not in any way to correct you per se, but to just say if we all need to be using the correct terminology, because it's very important to understand the differences between these things. And certainly the sentiments you have expressed are shared by some childcare providers, but I can say from having read the 1,100 comments we received on masks, we also have owners, teachers, and parents who applaud the mask wearing requirements. As we discussed when we talked about this guidance, we have to take, in general, social distancing completely off the table as a mitigation strategy in childcare, because it just simply does not happen, as we have heard from hundreds and hundreds of childcare providers. It is not realistic. If we are going to go back to the group sizes that we had, we have very few other tools to actually protect from the spread of the virus. And so with OHA's guidance, we have moved to draft these requirements associated with face coverings and masks. Of course, they're not final yet, so indeed we may change them, but that's really why we ended up where we did.
And I understand the rationale. I'm just saying I think it's going to be very difficult.
Yes, I understand.
Thank you, Mary and Joan. Any other comments?
I just have a
Paya Jocelyn.
Yeah, thanks.
Go ahead.
I think I heard this, but I don't remember. So thank you for reminding me of this if you have the answer. I know they're coming out on the 14th, but was there some implementation date that's slightly further out than that, the beginning of September or something like that?
We did ask for input on implementation dates, and as of last night, we don't have a firm implementation date because the data that we got was basically half of the group wanted them to be effective immediately of the 1,200 people, and half of the people wanted a month or more to prepare for implementation. So we have some further consultation that we need to do with OHA to be able to make determination about the effective date.
Okay, thank you, Joan.
Yeah.
Okay, thank you. Any other questions, comments?
Toby.
Toby.
Good morning. I was in a meeting this morning, and I was with centers and different programs, and they were asking if regular licensed childcare was going back from emergency to regular, and I told them no, they still have to apply for emergency, but they were on a call yesterday and they didn't think that was the case. So I'm still I don't know if there's something sent out to everybody or going to be sent out to everybody saying that you still have to apply for emergency care, even if it's a new program opening up. I think there's some confusion on that part because they all believe that childcare is going back to normal with the implementation of these new health and safety rules.
Thanks, Toby. I'll pass that along.
Okay. All right. Well, thank you, everyone. Thank you, Joan, for that update on where we are in the process. And just want to say, just call out to our leadership team how inclusive this has been. It's and how much time and effort it's taken to get the feedback and hear the voices of the providers and the parents. So very appreciative of that because I know it's been a lot of work and very inclusive process. Thank you. So let's go ahead and move on. Oh, Mary.
Since I have you, I just have a question about school programs that want to open a childcare, and some were open and then they weren't. One is at SOU and the other is in a charter school. So it says if they're exempt that they can't apply or they need to show community need. Is that still the case? That they would have to send something saying community need?
I'll need to get the exact specifics, Mary, but I think really that's one of the reasons why on page 47 of the K-12 guidance, or at least it was page 47 of the, I'll have to look and see, but it talks in there about working schools need to work with childcare providers and others in their community because there is a desire to have a strongly recommend that we don't open any new childcare unless there's not any feasible way for existing childcare to meet the need, and that if there are providers in the community that may be closed but would open if they understood the need, that would be like the preference to schools operating childcare directly that haven't had a tradition of doing so. So I'm happy to follow up on your question and make sure we get you the right information.
Okay, and this is a preschool at SOU that's been open for years.
Okay. Okay.
Thanks.
Yep.
And that's Southern Oregon University, for those of you who don't know. Okay. Dawn, did you have something that you wanted to say about that specific question? I thought I saw you unmute.
Yeah, well, yeah, I mean, so I'm not sure about future guidance, but I can tell you for the currently, you know, if they are exempt from licensure, they are exempt from emergency childcare, needing to. So for the instance of a university, they would not need to do that. That's the current state. They would not need to apply for an emergency childcare. They certainly can. It's not, there's nothing prohibiting them to, but it is not a requirement, just as licensing is not a requirement in pre-COVID times.
Okay, thank you, Dawn. So Dawn, do you want to just pick it up from there and give an update on the grants? Thanks.
Yeah. Good morning, everybody. I always love to see everybody on these Tuesdays. So an update from what I told you last week on the status of where we're at with the ECC grants, both phase 1 and phase 2. I'll start with phase 1 because there's not as much movement. We've actually had 6 additional people decline a grant agreement, so for a total of 26. We are continuing to look at the reports, the first report for that second payment. As they trickle in, we've done the bulk of them. I know today I sent 3 off to TRI to get their NACRAWare status, if they're in referral status, to help make decisions on ones that had reported that they had closed for a certain amount of days. And so we just keep kind of moving the batches through as they trickle in. There was no deadline on getting the report in, so it's as providers complete it, we go and award as we can, as information comes in. So again, not a lot of movement there. We're really just continuing to reach out and figure out, you know, what's the delay, calling providers directly if they want to, you know, where they're at in their process. On terms of phase, but I will say also, we have not sent out any notification of people who have been denied payment yet because of their report, their second report. We want to make sure that those have all been completely vetted before we send out the not so good news to providers. So we tell them that they're still in process, still in a review process. So if some are taking longer, it's because of they were closed longer than the 14 days and their rationale is still being reviewed. For phase 2, from the last time we talked, we've awarded another 64 grant agreements. So that total is 875. We've also made a ton of progress. Last week, I said that there was 428 that were in an initial review. We are down to 201. So we've reviewed and made decisions on an additional 227. Those numbers are not going to match, right? So don't start doing the math and tell me that it's wrong. I know that, no. But that some are duplicates that we find. And so there's kind of this whole initial review. Sometimes they submitted multiple. And so, but we've kind of been able to work through those. So that's why we've, you know, made about half we've gotten through again. And so I would say these last 201 are really being hand looked at in terms of, you know, why is there a mismatch? And I think a good example that we're doing, and I think I'm really excited that we're doing this for providers, is that we have cases where, because of how the phase 2 grants were set up, if a license exempt provider clicked licensed, we are not able to award them that grant because they missed an essential question of, are you caring for a child of an essential worker? And so what I'm doing, actually, I'll say I'm the one doing the work, is I'm actually calling that applicant and asking if they want to update their application, and I'm doing it with them on the phone over the phone so that they do not need to go back in and amend their application. And so I can say they're all very appreciative of not needing to go back into SurveyMonkey Apply and make those changes. And so that's a part of the 201 that are left. Also finding that some of them marked that they're not licensed, but actually are licensed. And so we're doing the same, but the majority is they mark licensed and they're exempt from licensure. So we're working through correcting those. So far to date, we've only had one applicant decline the phase 2 award. And I think one of the things that is going to be important, we know that the payments have already, have been delayed. We've not been able to make the 10-day mark. But we know that because this is the end of the state fiscal year, that our fiscal office is going to be things are going to probably move even slower. We're doing our best on the grants team to have as much teed up and ready for them as we can. So once they get kind of done with their year end, we'll have some good batches. One thing that we've learned is the bigger the batch, it's the same amount of work if we have a big batch from a little batch, to pay 2 people versus 100 is not much difference in terms of the time that it takes. So really trying to work hard to get as large a batches as we can ready for when fiscal can do that work. So with that, any questions? That is my update.
Okay, I'm not seeing any in the chat or hands. So thank you so much, Dawn. Appreciate that. Oh, it looks like there is one in the chat. Mary, just confirming that early learning programs and school settings must follow the emergency childcare guidance, even though they do not need to be an approved ECC facility, correct? So back to emergency childcare. I think Dawn.
I cannot comment on that. I don't know what it's saying in terms of, I think that's somewhat of a future. In the further guidance, I'd ask Joan to kind of weigh in if she has any information. I don't have that information.
Okay, thank you.
Mary, I want to confirm your question with Tammy. I believe that is true, but I want to make sure that it's true so that we don't get any false information out there.
Okay. Thank you. All right. So we are moving along on the agenda. I believe that Hannah is next, but she's joining late. Is that correct, Candy?
Yeah, but I can explain it. It's actually just a quick request. So welcome everybody, and especially Leslie. Yay, we're so excited to work with you. So directors may have already noticed in their inbox this morning, although Mary noticed it very late last night. Just a request to fill out a letter of support. I sent a template. You can just add logos if you're in agreement, but essentially our team is partnering with one of the other departments on campus, the group that works with the bilingual teacher scholarships program students. So a partnership between early learning and higher ed at WU, and it's called Project CARE. The letter sort of describes it, but as many of you who filled out grant applications before know, the more letters of support we get, the actual more points we get towards the grant. So anybody who currently has a Spanish-speaking focused childcare network, we're really asking for the directors and the coordinators to sign that letter and fill in any information. I think it asks also to fill in how long you've had the network. And the goals of the grant, as they're currently being written, or at least the project that we're proposing, is to help the bilingual teacher scholars students get their 30-hour practicum in a virtual setting, and that would happen through partnering with a family childcare program anywhere in Oregon. So for example, if the bilingual college student happens to be from Hermiston, they might get partnered with a childcare program in their community. And then what they would be doing is working with the family child care providers to talk about some of the needs of the children and families in their programs, and then creating some activities and what would be called a learning activity kit with materials to support the program, the family child care program, which would also support the learning and development of the children in the program. And that would be also tailored to or customized to what the needs of that particular program are. So if they're serving infants, toddlers, and preschoolers and or school age, it would address the needs of all the children in the programs, but would be co-developed and co-designed between the family child care providers and these Western Oregon students. So kind of an exciting opportunity. We really hope we get the grant and that it could be possibly replicated in the future throughout the state. Unfortunately, there's only approximately 30 students that need this type of practicum work, but that's 30 placements around the state, so we're excited about that option. And then another part of the grant is some just stipends for the students and the providers, because this is the commitment of their time, obviously. And those stipends, the goal would be to be used however it's needed by the providers. So if they want PPE or they need any COVID-related supplies, they can use it towards that, or their own professional learning, or whatever else that they wanted to use it for. So it's pretty open-ended in terms of what the stipends could be used for, but it's definitely support the learning of the different children and families around the state via the family child care providers. So that's where we're at with that. And even if, I think this question came up earlier from a director, even if their Spanish Focused Child Care Network is no longer operating, if there's still a strong connection with those providers in your community, I think it's still appropriate to fill out that letter of support if you have that ongoing relationship, because that's certainly what we have indicated to our partners at Western Oregon University, that we have these ongoing relationships that are authentic relationships that really have sort of our finger on the pulse of it. I should have mentioned right away that Maria Fernandez is going to be our sort of key person working with this project. And as many of you know, she's been a quality improvement specialist and was also a Focused Child Care Network coordinator. So she would be working with all of you to help with the placements and if we get this grant. So I shouldn't say if, when we get this grant, with your help, with those letters of support. I apologize for the quick turnaround because we really do need these letters. That's why we gave you the template, and you can just doctor it up, throw in a logo if you're in support of it. I don't want you to give us a letter just because. I want you to truly be in support of it. That's what the project needs. But I think that's where we're at with that. And in the notes, I'll have a little bit more details, but also in the letter itself, if you read through it, you'll get a better sense of what the project goals are. Any questions about that?
Thank you, Candy. If I understood right, you said that all of the directors got a letter about this, and you were just filling in more of the details. Okay, great.
Yes, and so because it says like urgent requests, so they're like, what is this about? Hopefully it won't take more than 5 to 10 minutes of your day to just, again, put in logos and amount of time and the names of your coordinators. If we got it wrong, we were doing our best guess from our most recent information. Hannah and Maria obviously worked with all of you with Focused Child Care Network, so we think we got the right information, but we may have gotten it wrong. So just change anything, and you can always call me or Maria today or tomorrow. Because the grant is due Thursday, so we're just trying to get them in as soon as possible.
Thank you, Candy. Any questions? Okay. Well, let's go ahead and move on to John and Sydney to talk about the annual service implementation survey, which I know you have seen on your deliverables. So we wanted to just provide more information about that and what to expect.
Hi, we are really working in the contracts department to make sure that we're not requiring anything that's not directly written in the contract that you have in your hands. So even though we know it's coming, you don't have your contract amendment that has that in it yet. So we have it done and ready, and we will be sending it out, and we will have the due date be 30 days after the execution of your grant that's coming out, so that you'll have time to do that. So you can ignore the due date that's on the deliverable calendar right now, but know that it is coming. And I just kind of wanted to run through what is in the survey. This is something that we're going to be doing twice a year. Sometimes it will have it will have some questions that are the same every time and some new questions that are just relevant to what's going on in the world that we're in at that time. So it is a grant requirement for all QIS, including infant toddler specialists. We're defining them as QIS as well, to fill out whether they're network or non-network. There are some questions in there that apply only to network leads, and so there's an option on all of those questions for NA if it doesn't apply to a QIS that doesn't lead a network. We are asking not for the person's name unless they volunteer it. If they'd like some follow-up, they can tell us their name. We're only asking the SDA, and the reason that we're asking that is so that we can kind of look at your list of folks and know that we got 12 people from one SDA, and that's how many QIS there are. So we can follow up directly with the director if it looks like there are people that haven't yet answered it, but we won't know which people in particular haven't answered it yet. And we're going to be asking things like how many networks, ELD funded networks do they run? Again, 0 is an option because we're going to have people answering this that are not running networks. And also how many non-ELD networks, just so we can get an idea of what's going on, because I know that there are non-ELD funded networks out there. And then we want to know the type of work that's typically done by these staff outside of their network work. That's things like supporting licensed people to change their license type, doing class ERS observations, doing CPR first aid training, writing trainings, planning conferences. What kind of stuff are folks doing outside of their network work? We want to know their confidence in their ability to do different things like using Coach Companion, supporting provider goals, helping providers set goals, implementing what they learned from Lead Learn Excel. Again, these all have an NA option if it's someone who didn't go to Lead Learn Excel or isn't doing one of these things. We want to know how often people are using Coach Companion. Never is an option because we know there are people that are not using it. And how they use Coaching Companion, NA is an option there. And then have they used any of the different Lead Learn Excel tools like protocols or data dialogues, things like that. And yes, no, and what is that is an answer. So if they're not even really sure what that is, they can let us know that, and that's fine. And then there were pieces in the TA log that we didn't want to ask every single time. We were trying to streamline that a little bit. Things like how much time are they using planning and traveling and documenting and things like that. So we have a question on here about on average in a week, how much time do you spend doing the following activities? There's also, we added a once every 2 weeks and a once a month, or because we have some things like internal staff meetings and one-on-one supervisor meetings to get an idea of what their time use is on those things as well. We are asking at this time, what support do you provide on the emergency childcare guidelines? That might be an example of a question that's not there in the future because it's really relevant to what's going on right now, but that's one that's in there. How familiar are they with the emergency guidelines? And then there's a little narrative section talking about what other kind of follow-up they do, documentation, if they're not using the TA log, or what additional documentation they do. What do they find useful about the intentional referral meetings? What might they change about them? And then a space if they'd like to share anything about successes, and a place to let us know if there's any training that they're interested in. We do have a space for them to put their name if they would like follow-up from someone at ELD, but it's completely optional. And then a space just to let us know anything else they would like to, if they would like to share anything. So that's a rundown of the questions that will be on it. And again, you don't need to worry about it right now. We'll get it out to you when we have the grant executed, and then you'll have 30 days to fill it out from then. Any questions?
Thank you, Sydney.
Yeah, Shannon.
Go ahead, Shannon.
So just going back, you asked, you're going to ask a question about travel.
Yes.
So is there a way to do like a pre and post from COVID, because that's really switched and changed?
So that's a good question, a good clarification. I think that we're thinking about this as of right now in your current, so whatever it is right then in their current circumstance, it will be during COVID. So it will be less, and we'll just know that when we look historically back on the data, like this was the time of COVID, so the travel is going to be a lot different. That's a good.
Yeah, I would just make sure to clarify that in your question.
Absolutely, I can do that. Thank you. Any other thoughts or questions about this?
Jerry has a question in the chat box. Does it ask what a person's FTE is?
It doesn't currently, but we could certainly add that if you don't think that it would be too pointed to who the person is.
Jerry, did you want to speak more to that?
Sure. So when you're asking somebody about how much time they spend, well, that's really going to, if they are only at 0.5, then, you know, they may be spending a huge portion of their FTE funded by the grant in these various tasks. So it really does change how you look at the work and, you know, what a person is doing. So, yeah, that's my.
I'm happy to add that if there's no opposition from any other directors in adding that in. Okay, will do.
All right. Thank you, Sydney. And I just want to mention, you might want to check the chat box. Joan did answer the question about the school emergency child care guidelines. And then also Karen Prow was asking, work outside the network funded by other dollars. There will be questions about that in this survey as well.
There is a question that asks, how many ELD funded networks do you run? And then there's a separate question that says, how many non-ELD funded networks do you run? And there, again, 0 is an option on both of those.
Great.
Hey, Margie.
All right. Yes, John.
I just wanted to chime in for a quick second, not really about the current subject, but I noticed today we have a ton of people not showing themselves on camera, and I know there's various reasons why they might need to do that off and on, but I'd love to see everybody who's interacting on the call as much as possible, just because we used to do face-to-face meetings all the time, and you can see the nuances of when something resonates with people and when something doesn't quite land all that well. And I really actually appreciate the ability to sort of know how people are engaging with the information. And since I have to sit here and you see my blank look on my face all the time, and you can tell when I'm not engaged, I'd just love to see everybody else as much as possible too. So if folks can't get on for whatever reason, just consider this a public shaming. It's not a big deal. Thanks.
Thanks, John. Yeah,
and I just took myself
visual
off so that everybody could get in if they needed to, but I'll put myself back on once everybody tries to get on.
Visuals are good.
I didn't consider that. Sometimes people aren't able to get their camera to show if there's too many people in the call. So again, then we'll just say, you know, you got here late and we'll shame you for that. It's not a big deal. Not a big deal. Just kidding, folks.
Okay,
Go with it.
John. Thanks, John. No, actually, it is really nice if you can be on camera for us to see each other. It's a really good way to connect. Okay, so any other questions on the survey that you do not need to do until the amendment is executed? All right, and this really does align with our desire to have a continuous quality improvement foundation in all the work that we do. So we want to make sure this is happening. Oh, Lynette, our traditional exempt preschools, okay, we're going back to emergency childcare with this question. Our traditional exempt preschools exempt from ECC and do not need to follow the guidance. It looks like Joan stepped away for a minute. Lynette, can we get back to you on that? And then Melinda, the humor and okay, thanks. The humor and opportunity to hear laughter is one of the things I miss most about our virtual lives. Yes, so true. Okay, Toby, before I call on you, I'm wondering, Joan, there was a question that came in the chat box from Lynette. Are traditional exempt preschools exempt from ECC and do not need to follow the guidance?
I will shoot it on over to Tammy.
Thank you. I kind of think they do need to go through the ECC process. That's what my memory is of the guidance, that they do need to be approved. Okay, but we'll find out for sure from Tammy. And so, Toby, you had a question.
So just to make sure I understood this correctly. So this survey, will the ELD be sending this out within the 30 days after it's executed, or does it come to us and we send it to staff?
I'm open to what would work best for you to do that. I can collect all of the email addresses that TRI does such a great job keeping up on for your QISs, or I could send it to you and you could send it out to your staff, whichever works best.
I'm thinking you guys send it out to them and just copy us. I'm just trying to make sure that I don't overlook something.
Sure. Well, and I'm hopeful that I don't miss anyone too. So I will CC all of you, and if you have a chance to check in with your staff at the next staff meeting after that and make sure that everybody received it, that would be really helpful.
Okay, thank you.
All right, thank you so much. So let's go ahead and move on to coordinated enrollment trainings, and Ann Morrison, who is the coordinated enrollment manager. I believe that's your title, Ann. Correct me if I'm wrong. And you're going to share where we are with all of this and what we can expect.
Yeah, that's my third title in under 2 years, so it's sticking for right now. Stay tuned for a while. But yeah, so we are working on really ramping up on coordinated enrollment, facilitated and led with our early learning hubs. In the midst of a lot of changes happening with COVID-19, with Preschool Promise expansion and the implementation timeline associated there, you know, even more so, I think coordinated enrollment for these next months is going to be really heavily focused on Preschool Promise and really thinking through enrollment processes specific to Preschool Promise. And so wanted to give a little bit of update. I think just like you all in your role in Preschool Promise, the hubs are essentially trying to prepare while waiting for the intent to awards and the executed contracts to be in place to really begin a lot of these processes. So what we know of what will happen for enrollment into Preschool Promise is that as we have executed contracts with providers, any eligible families that are already enrolled with those providers but may be paying privately or through other means will be given the opportunity to apply for those Preschool Promise spaces with their provider. It's sort of ELD's commitment to continuity and to try to avoid any displacement that can be avoided. So the hubs will really first be focusing on determining eligibility for those families so that they can move in or convert into Preschool Promise funded spaces. To support that, we are starting training for Early Learning Hub staff to really do a deep dive on how to determine eligibility. I think for any regions that had Preschool Promise, this is a shift from providers doing eligibility determinations and enrollment to having a more centralized location in the hub to do those enrollments and to process that. And so we're having trainings starting tomorrow on how to determine eligibility and trying to kind of make moves to ensure that we have a system in place and folks trained up to support eligibility determinations for those families. And I think as we move forward into more of these enrollment processes, plan to have additional training and technical assistance on kind of the full range of enrollment, kind of from an outreach or recruitment statement or sort of process to do that through to kind of selection and placement of children into the spaces that remain after we have our after we've got our continuity enrollments completed. So I think Preschool Promise implementation being a time for a lot of different new continuing roles around the ECE sector. Wanted to extend the invitation for you all to listen in on some of these trainings, or I should say the one training done multiple times. I think, as we're getting towards implementation of this expansion of Preschool Promise, I think as much as possible having opportunities to learn and understand the new or continuing roles that we'll all be playing in community around Preschool Promise, and work with families, enrollment, and then work with providers and some potential partnerships and stuff. Wanted to just use this training as an opportunity to kind of try to give a little more insight into what the hubs will be doing and what their responsibilities will be in the immediate, and then sort of hoping that this is one of many opportunities to kind of open the door, come together around really understanding kind of the roles and the potential supports in community that that this could look like. So I have a link which I'll send out to sort of see if anyone would like to sign up to listen into these. I should also mention the trainings will be recorded, so I think just wanted to make sure it was available, and that you all were invited to attend if you'd like to, but also there'll be a recording available, I think, as we continue in Preschool Promise expansion, just having those documentation and times to kind of engage around some of those responsibilities is our intent here. And I think would any questions or be able to kind of give some insights where I can, I'm happy to take any of those.
Any questions for Anne? Comments? Okay, I think you answered the one that was in there, and that was the link for the training. So being able to send that out to everyone. And Anne, if you wanted to send it to me, I could forward it on, unless you have the list of all the directors. So whatever works best.
I will trust you, Margie.
Okay. All right. Thanks. And what time is it? There's several of them, right?
Yeah. There's multiple. Yeah. There's morning and afternoon options on almost every day for the next week and a half. So you'll see in the sign up, there's many to join if you are so inclined.
Great. Thank you, Anne. And Jerry Wolf says thank you for including us in the training, which was one of the beauties of the community system team is as we talk together. And we have these ahas. Oh, let's include the hubs. Oh, let's include the CCRNRs. So thanks. Okay. So I am seeing more comments, requests regarding emergency childcare clarifications. I would like to just ask that perhaps we have some time to talk about this in a few moments after John talks about the strengthening business childcare training of trainers. It looks like we're going to have some time to maybe have a little more discussion on what we might need to clarify around emergency childcare in this meeting. So let's do that. If there's no objections, I'll add that to the agenda towards the end. And then we have another question, preschool promise programs, will they be getting the training too on eligibility and coordinated enrollment?
So this is the downside of being on camera is I jumped away for just a second. Was it that preschool promise providers would be so not at this
training,
yeah, not at this time. I think the intent behind this eligibility training is that this is something that we're asking the hubs to do from a centralized place rather than asking providers to do. I think we have potential for more kind of, how are we engaging and being transparent with providers about the enrollment process generally. But at least this first training has not been extended to any of those providers.
Okay, thank you, Anne. All right. So, John, you're up. Talk about training of trainers. One more thing.
Just one more thing. Let's see. I'm going to go back in time a little bit here to give a bit of a preface around this subject. So it was well over a year ago, I think, that Sandy was actually working with the National Center on Early Childhood Quality Assurance with a training that they had created nationally called Strengthening Business Practices for Childcare Programs. You guys might have remembered that we talked about how we might be bringing that to Oregon and how we might administer that all pre-COVID. Ronnie Pham picked it up somewhere along the way and did some additional work with the folks at that national center and was continuing to kind of move this forward and kind of handed it off to some others of us in the department, but we were, continuing to figure out what way this might all come together and work. So then fast forward to about a month ago, when Dana Blakeney-Hipsch and I were planning our Infant Toddler Specialist Network Community of Practice. We were actually, and I don't know how familiar you all are with this, but we work with Region 10's State Capacity Building Center, which is through ICF. I can't remember what ICF stands for, but they're the company that's contracted through Region 10 to do TNTA for our states. And so April Westerman's an infant toddler specialist there with Region 10, and she works with us on every one of our monthly community of practice meetings with your infant toddler specialists. And so one of our topics of conversation was we really wanted to get some information in front of our infant toddler specialists around supporting businesses, especially businesses that are caring for infants and toddlers, because right now we believe that they're the most fragile programs that exist, because their profit margin in serving infants and toddlers was very, very small before COVID, and what it did to affect their programs after that, we know it has been pretty significant. So what we've always thought around an infant toddler specialist and other quality improvement specialists at large, I think when we think about an infant toddler specialist, though, there's a huge need to ensure that they have a holistic body of knowledge that's not just about environments and serving infants and toddlers, and having developmentally appropriate practices and those sort of things, they also need to understand the unique aspects of budgeting for a business and serving infants and toddlers, because those two things go hand in hand. Most programs in our state, I mean, we know we already have a massive childcare desert for infants and toddlers throughout Oregon, but most childcare programs that are serving infants and toddlers are teetering on whether or not they believe that that's where they should put their emphasis, because at any given point, it's like, you know, I could serve preschool children and I could make more money doing it. The folks that are really invested in this, we want to keep them thinking about doing it for the right reason. So supporting infant toddler specialists with business practices has always been something that we want in their toolkit, even more than the general quality improvement specialist might potentially need that. So anyway, we wanted to give them a quick little down and dirty this month around business practices so that they could be supporting providers that were thinking about reopening or ones that have been continuing as emergency providers. And so you may have heard, and you may not have heard yet, that your infant toddler specialists actually got trained in a training of trainers yesterday in strengthening business practices for what is considered module 1 of the thing that Sandy and Ronnie were putting together for Oregon months ago. So that all happened within the last few weeks. They were going to do kind of this hybrid based on the content within strengthening businesses. And then decided, well, if we're going to spend an hour and a half with them, why don't we just expand that time frame and give them the certification, because they were really interested on a national level to do this with a group of infant toddler specialists, because that's not been the way that they've approached it in the past. And so what we were expecting was a little bit of a focus on how they might help providers right now in projecting their budgets during this very strange period of time when they have lower enrollment and lower ratios and more staffing costs and things of that nature. And so they decided to flip it on us, but I think it was an added bonus. The staff ended up getting certification in module 1, but where we're at right now, and so what I really wanted to, that is the entire frame up for what we're going to try and do within the next few months. And so what we really want to do is be able to offer the additional 3 modules to the infant toddler specialists so that they get the full suite of training in a cohort. And so we'll be trying to schedule those follow-up trainings, and this is all based on the schedules of these national trainers. And then what I'm really trying to do here at the same time, and Dana's going to help me figure this out, and we're going to bring Sydney into the middle of it too, is figure out how to get a parallel set of these trainings for other quality improvement specialists in our system, so that we get this strengthening businesses training available to all of your team members. And we want to try and get it, we want to get the train the trainers scheduled before the end of this calendar year, if there's any way possible to do that, because we know that what is needed most right now for childcare providers is significant supports around their business acumen. And so you would be able to decide who you want to prioritize to get to those trainings. But I am going to do my best to nail down some timelines and what dates those might be. What we're hoping they would be able to do once they schedule it is to provide the modules in like every 2 weeks, and there's only 4 of them, and they're like a 3-hour session. So it's like, you know, it could take 2 months to get it done if we did a session every 2 weeks. But we will get that information to you as soon as we can possibly nail that down with the national folks. And I apologize for not letting you know that your staff were going to be trained as essentially trainers in something that happened just yesterday, but I don't think there's any harm in it, as far as they are more than able to just utilize some components of that as they're talking with providers. They do not have to provide the training in an official format. They can't just, though, take that information and pass it on to another quality improvement specialist to do the training. Each person who receives the actual trainer's manual needs to utilize it for themselves as a trainer. And so that's why we want to get this available for any of the specialists that you might have or other staff in your programs that you want to get trained as business folks. And you may have staff that are already sort of the business specialist, and of course we'd want to open that up to them too when this opportunity comes down. And so all that being said, it was an interesting opportunity. It sort of evolved in a very short period of time. It went from being just a nice community of practice conversation to an actual module 1 certification. The 4 modules, just so you guys are aware, the first one was budgets, projections, and planning. The second is, and these are the ones that we'll actually have to get scheduled out in the future here, financial reports and internal controls, marketing for childcare programs. And then the fourth one, I think, is only for center-based programs, which is staff recruitment and retention for center-based childcare programs. I think there's probably something middle ground there that would work also for certified family childcare, but I don't know why they chose to focus specifically on centers for that one. But both family childcare and center-based providers, they sort of have 2 separate versions of this training that can be offered when your folks are trained in it. And we found out that another state did already translated into Spanish, and so they said they would get us the materials so that when we train our folks, they will have that available to them also. So it's a great opportunity. It's sort of something that was attempted to, we were attempting to bring this to you much sooner than when COVID hit, but it's coming now and virtually, which is actually probably going to be easier to get the materials in the hands of your folks than when they were going to try and come to Oregon and regionally provide this training. So I'm going to pause for a moment. I think there's a few questions in the chat box, which I love, and then also open it up for other questions people might have. So I see
some of the questions have been answered, so thank you, Dana.
I answered the English, Spanish.
One is repeating the name of module 2, financial support and
financial reports and internal controls is module 2. Jessica, yes, there's 4 modules. Oh, that was already answered. Okay. Any other questions?
John, this is Lynette.
Hi, Lynette.
Can you send just a brief summary with the titles of the 4 modules, and if there's a description at all? That would be helpful for training coordinators.
Absolutely. And the other thing that I'm thinking is because this kind of came around in an odd way, I need to coordinate with folks at the Center for Career Development just to talk about whether or not this should become something that we want to have in our standardized training pool, and how it lands on the complexity level of whether it's a set 1, set 2, that sort of thing. And so we didn't have time to do that because we didn't really know we were going down this road so quickly, but I will chat with you, Pam, and your team, and get you more information, and we'll work through that. And then Lynette, I'll make sure I send something out to everyone that gives you at least a brief overview. I might actually have a link I can send you before this meeting's over. So
great, thank you.
And Jessica, of course, already sent it. That's so Jessica. Thank you.
Jessica.
And yes, Mary, are the materials available in Spanish along with the modules?
Boy, I could almost formulate a sentence. The participant materials are available in Spanish. The trainer's manual will not be in Spanish, at least as of yet. And I think that's at least, it gets people moving on this. So, and it was another state. It's funny how these things work. Things get put together nationally, and the translation part of it is not always the first thought of how they might do this. And so, like with 0 to 3's critical competencies, we're very close to having all those materials translated into Spanish, and that was a huge undertaking, by the way, massive amounts of information. But Oregon put together the process and actually funded that in its entirety for 0 to 3. And so now other states will eventually have access to those Spanish materials. So what I'm excited about with this strengthening business training is there's like 34 states that got trained in this these 4 business modules before we got access to them. And so some other state was as smart and as great as we are and got it translated before we had to say, why can't we get this translated into Spanish? So anyway, maybe we'll help them figure out how to get it into other languages as we move along. So any other questions? It looks like Shannon's hoping that it's a set 2. I seriously have no idea whether it is or isn't, but we'll keep you up to date on what we find out.
All right, thank you, John. Any other questions, comments? I am not seeing any. All right, well, let's take a deep breath and look into emergency childcare questions and some requests. Joan has been connecting with Tammy as we've been in the meeting to get clarification. So thank you, Joan, for doing that. I want to just go back and revisit some of the questions and making sure that we are responding to them, or if we don't have them, we will be sure and get them onto the list to Office of Child Care. So one of them was to have clear communications for recorded preschools and programs, so that it sounds like, Heather, you were asking, is there a document or in our documents on our website specific to emergency childcare, there's clarity around what recorded programs need to do. Is that correct?
Yes, I would say that the questions that I'm getting are what applies to me. So I've just kind of been back and forth with licensing about what that looks like, and they're just pretty confused because they don't normally engage with licensing things that much. So I'm sending out links and communicating, and it's good because they're kind of coming in for answers more. But it'd be nice if amongst the different kinds of licensing or different things that are listed, even saying recorded preschools, this applies to you. this is they're mentioned in the list of that, because we're putting things out in general.
Yeah, Margie, can I also say a couple things?
Yes.
Yeah.
Yes.
So one of the things that kind of came up on the engagement that we did on Friday afternoon with the CCRR directors was a kind of reminding all of ourselves that essentially childcare in Oregon right now is closed, except if you have applied and been approved to be emergency childcare. And by doing so, you agree to do certain things. Under that, and because we're still under a state of emergency, which is, of course, why it's called emergency childcare. Just to restate the context we're all operating in, because it came up on Friday that people were like, yeah, it seems like, so much like the new normal that we almost don't remember we're under a state of emergency where, half of childcare has chosen to be closed and half has chosen to be approved as emergency childcare. So how recorded programs have been covered under the current guidance we're working under is likely to be different going forward. As you saw, if you've been following what I put in there, where I put from Tammy, like, we need to stay tuned to what's going to end up in the August 14th guidance. So recorded programs under the current guidance were being treated a bit differently because, again, we're operating during a state of emergency, during a global pandemic, and in the, you know, with an excess, I think, or a desire to be as focused as possible on health and safety, trying to make sure if programs were open, recorded programs were open, that they were following guidance. So I appreciate that people are now looking for complete clarity. We want to understand all of your questions and we'll endeavor to get them answered. And just know that we're also in a space where we're probably going to be transitioning and there might be different answers coming related to recorded programs.
Great, thank you, Joan. I think that one of the things in the new guidance that comes out, we're going to have the clarity on the website, which will be helpful because you'll be able to go right to that and look at it and respond. But I think to Joan's point that the programs are considered closed unless they have gone through the emergency child care process would apply to recorded programs. And I know there's preschools, there's camps, there's everything like that, but just knowing we want to stay clear with safety and health guidelines that they would need to go through the emergency child care process. They have more than 3 children, and that's kind of been how licensing has been looking at that. So I think that's just use that now as the guidance, and then we'll have more clarity as we go along. And also, as you're getting questions, and I know Lauren and Ikeka, who are doing the helpline, are getting similar questions. So that's helpful for us. So as you send them to us, we can move them forward and say, here are the questions that are coming from the field, and we can help to respond and have more clarity. So anything else around that? Okay, there was a request for maybe a conversation around some preschool promise, some questions around preschool promise. And I see Dana and Andy are smiling. They are on camera, and I can see that they're happy to answer any questions. And we can also gather questions if we don't have the answers yet. So let's go ahead and I'm trying to track the chat box as John and Sydney are as well, but if we have any questions, maybe people could ask instead of keying it in. That's really helpful for people who facilitate. Okay, Mary.
Margie, this is Dana, and I can go ahead and kick us off. There was an email that was sent out to grantees yesterday to go ahead and gather information about startup funds. As some of you may be aware of, with our Preschool Promise, we have a bucket of services dollars, which is what we include in the intent to award list. And then there are some startup funds available for limited funds. Disclaimer right there, we don't have a lot of money, so limited funds there to go ahead and support our grantees with this next expansion of Preschool Promise. So there was a pretty short survey that was sent out yesterday, just trying to go ahead and gauge the energy from people as far as like what do they need for Preschool Promise. So it was sent out to them yesterday in English and Spanish. We're not looking for a list of everything that they want to buy at this point. We're really just looking for yes or no answers, and that information is going to go ahead and help us develop our funding formula to be able to then include those funds in their contract for Preschool Promise. And then later on, that's when we're going to go ahead and get into the weeds of like, okay, John, we're giving you X amount of money. Here's the stuff that you can only buy for. What are you buying? How is this tied to quality and so on? That's why that's mentioned the CCRNRs along with like the ECRs and class and some other, processes there in there. So remind your providers, your grantees, as you're communicating with them, fill out that survey so we can go ahead and get that data, so we can go ahead and just develop our funding formula with Preschool Promise and the limited funding. We're going to have grantees that are going to need a full classroom. It's an empty classroom. They don't have anything. So we know that we're going to need to go ahead and support in that way. And then we're going to need some that may just need enhancements to their environment, maybe because they were a previous Preschool Promise provider, or they've been running their business for many years. So just something to keep in mind. We will be sharing that email, forwarding a copy of that email to all of you for you guys to just motivate the grantees to go ahead and do that as soon as they can. Andy, I don't know if you want to add anything to our startup process.
No, I think you summed it up pretty well. You'll see the email, which also tried to give information to the intended grantees. One thing to remember is that nobody has a fully executed contract at this point, that we're still in that process. And so this is really about us gathering some information to help prepare us for once we are able to move forward and execute contracts, to try and do it as efficiently and as quickly as possible. We know that timelines are short, and we know, like Joan said, that we are still in a state of emergency. And so trying to balance the different ways that we need to support our programs, but also understanding that some folks are in different situations, whereas they may need their funds in order to build floors and doors and kind of that piece, and other folks just need some funds to help them support moving forward and some quality improvement efforts depending on where they are coming in the door. So hopefully that email helps people understand a little bit about how this is just part of the process. It is not an application that they will need to provide additional information to us in the future in order for those funds to be approved for release, but this is just a way to help us queue up in our minds and into some formulas what that grant amount may need to be.
Thank you, Andy. Mary, I believe you had a question. Is that correct? Or was it answered? It was answered?
Yeah, thanks.
Okay, great. Thanks. Any other questions regarding Preschool Promise? Jerry.
So I'm wondering if we're getting any closer to getting an email that tells us about the positions that we're hoping to hire for.
I think closer is a good way to describe it. Yes, we are inching closer and closer to that finish line. There's some critical pieces that we're going to be doing in the next couple days that will support with that. Really on our end, it's more just the not logistics. It's the details of organizing the right words onto the right forms, but that scope of work that we shared with you will still be able to guide your thinking in terms of what generally those roles are intended to be. One thing that I would just say, like, to keep in the back of our minds, I've been thinking a lot about this lately, is again, when we first started thinking about these positions, we were in a different world situation than we are now. And so some of the details within the conversations that the program specialists and the coaches may be having may not be the way that we envisioned it. There may be some crossover and some more similarities than we had originally thought, just because now is a time when general consultation might be more needed and more impactful than one-on-one coaching. Also knowing that it's going to be very difficult and that coaching will need to be done virtually in a lot of cases, at least in the foreseeable next few months. So it's a long-winded answer to say, yes, we're getting closer. We hope to have that information to you as soon as possible. I always look to John because John knows everything and I depend on John, and he will tell me my timelines and whether we're on track. But I know that we are moving closer. And again, it's just getting the right words on the right piece of paper on our end at this point.
So
That's super funny.
I just with my administrator right before this meeting and about these two positions, and he basically said until we get a letter, we don't have to have the grant, the contract amendment, but until we get the grant, he will not be talking with our administration about this. So we need that letter that says you're going to get some money and this is what it's for before we can move forward. So I know you're working hard on it, and we're ready. We just need that piece. The other piece of this, and this is probably just a revision of what we talked about previously, and that is what should we be doing with our focus networks, given that we might lose that funding and it's second year funding and we're in the second year. And the legislature will not be meeting. I mean, we're not going to know whether we're going to have that money or not. So it puts us in a pretty iffy position. So if you have any guidance on that, I would be appreciated.
This is Joan. I can say that we are exploring possibilities of being able to partially to fully mitigate the impact of that proposed reduction, and have had some serious conversations with the governor's office and anticipate more conversations coming. I'm happy to take that question back to our leadership team, but at this point, I would highly encourage you to continue operating as you are right now. Providers need these supports, and we are working to try to find a way to be able to enable them to continue at the fullest degree possible.
Thank you.
And I would just insert in back to, I think, the preschool promise side of this, but I also just sort of want to say that the budgets that are being drafted and put together are encompassing more than just preschool promise, because you have an amendment on the way that may include some additional resources. And so all of that kind of comes into play as we're putting these materials together, and they're all, at certain points we thought the initial amendment might have come prior to the preschool promise positions, but now we're zeroing in on one big amendment with it all kind of put together in one package. And so when we have more information about what those budget items include and what that'll be for you, I think you will be pleasantly surprised. But I know you guys are trying to plan, but more resources are on the way. So
John, this budget amendment that's coming, what is the date? So is this money we're going to have to spend by June 30 of 21? Or, I mean, I'm just concerned that by the time I get it, I'm not going to be able to, get it happening fast enough to get the money spent if in fact June 30 is my date. So just another concern.
So I'm looking at Sandy, but I do know that the money is going into the current biennium's grant, which is a June 30, 2021 deadline. Whether or not it has any extension capabilities, that's why I'm staring at Sandy's face to see if she has additional input into that. Oh, Sandy, you're on mute.
Sorry, I was having mouse issues. Sorry, I also had a kid here talking to me about tea during some of that. Extending beyond June 30 for which portion?
Any of it.
2021? Like if the budget can go beyond that?
Right, if we're getting more money in our contracts, but we don't know, but we don't actually know about it and can't implement it for a while, then all of a sudden we've got a bunch of money that we have to figure out how to spend by 30. That becomes a challenge, because you hate to hire somebody and say, I may not have money for you beyond this 6 months, that kind of thing.
Yeah, I think that's a conversation we'll need to take back and have internally. In the past, what we have said is At the end of the biennium, when these federal funds cut off, there is no carry forward into another agreement. We start over and go from there. And that was something that was put in place intentionally by our previous budget analyst. So I think that's a conversation we'll have to take back internally and have and get back to you folks on.
Okay. The shortness, if I've got 2 years to plan a budget, no problem, I can spend it over time. But if you give me money, 9 months before the end of a contract, that's when it becomes a challenge. Not that I don't want money, I do, but I need to do it in an ethical way as it relates to real people.
Yeah, and you don't want to just hurry up and spend a bunch of money real fast just to get it spent.
Correct.
Totally. Yep, absolutely. Thank you, Jerry.
Good questions, Jerry. Thank you.
I have one more question. Are these funds that are anticipated to continue, or are these more one-time funds?
Well, as you know,
no guarantee, but
right. And so yeah, I would say yes, we are anticipating the type of funds that continue, but all bets are off in the legislature.
Yeah, I get it. Okay.
All right. Well, it was a full hour and a half of discussion. I just want to double check. Is there anything else? Any other question? We've covered a lot today. Okay, I'm not seeing anything, any hands, or I'm not seeing anything in the chat. So it looks like you get 32 minutes back of your day today. And really appreciate this time together. We will get the notes out to you, and of course the links to the recordings. Actually, I think we owe you a few of those, just trying to catch up with some of that. So everyone have a wonderful week, and we will talk soon. Thanks. Bye-bye.
Bye.
Margie.
Yeah?
It's Mary. I just have one more question, if maybe Joan or Andy or somebody could stay on about Preschool Promise. We have a charter school.
Okay.
We have a charter school that's been given a Preschool Promise award, and they want to start their Preschool Promise program. So they're a charter, so they'd be exempt. So they would not have to, she wants to know what she needs to do in order to start her program. Does she need to become, a licensed center, or just since they're saying that they don't have to be, they're under the charter. So for Preschool Promise, would she have to be licensed? I mean, what does she need to do?
I would say it sounds like there's maybe two different questions there, one for Preschool Promise and one for licensing. And so, if she's in a charter school, then she is, like was discussed earlier, not eligible for licensing. Eligible if she chooses to be, but not required to be licensed, because she's would be regulated through the charter school. So that, and Preschool Promise does not supersede DOJ in those situations. So that would be the question, the answer for licensing. As far as opening up her Preschool Promise program, that would be part of the grant execution. So right now, she just needs to hold tight until we circle back around. Do you accept these funds? Here's the grant contract. And those pieces, and then that grant manual will help explain what else she'll need to do for the grant execution and implementation of the Preschool Promise program.
So she has two things. She wants to open just a Preschool Promise program, and then she wants concerned about. She wants to open a preschool program and then her Preschool Promise program. So essentially, she can open the preschool program now because she's under no, requirements for licensure. She can just open it up. She doesn't need to be an emergency facility, but as far as Preschool Promise, she needs to wait until she gets the agreement. And then for Preschool Promise, she also does not have to be licensed, or just needs to be following the Preschool Promise guidance.
Yeah. So there'll be there'll be health and safety requirements that she will need to follow as a non-licensed program through Preschool Promise. But she would not need to. Preschool Promise programs that are located in schools or other entities that cannot that licensing does not have oversight over do not. That still applies. That non-oversight still applies.
So for Preschool Promise, when they say that they're supposed to be Spark, involved, is that still the case for schools, programs in schools?
Yes. All Preschool Promise programs need to participate in Spark, and then through the grant manual and the TA, then we can talk about what that enrollment looks like, but she will need to enroll in Spark.
Okay. All right. That's very helpful.
Sure. And if you have any other questions, just let me know, Mary. I'm happy to help.
Okay. Appreciate it.
Yeah, of course.
Thanks, everyone. Bye-bye.
Thank you. Have a good day.
See you soon.